Hello, Diaz here, founder owner Greenwood Dental. Welcome back to another video. Today I am discussing what food trap means. So if you hear your hygienist say, oh, you have a food trap on the lower left, upper right, I will explain to you what that means, and especially if the dentist comes in, your doctor comes in and agrees with her, you don't know what that means. But some of you come along or come in knowing that there's a food trap and actually will call for an appointment saying that I have a food trap in that specific area. I'm trying to clean it. I haven't been very successful, but also when I clean it, it hurts. When I clean it, it bleeds. Now, when you say I'm cleaning it, it really depends what you guys are using. Are you using a soft picks? Are you using just a toothpick? Are you using your nail? I have a patient saying that he uses a 1 cent, a coin that goes in there. That's how bad the food trap is. If you can fit a coin between your teeth, we have a problem. So food trap, what causes food traps? Food traps comes from a couple of things. Number one, if you broke a filling that's between the teeth, you're gonna create a space. And that space will collect a lot of bacteria, and also we collect food, especially the meats and especially the roughage like salad, broccoli, asparagus, when you eat popcorn, but especially steak and chicken, it will get stuck in there. It's just nice, perfect shape that goes right between the teeth and get trapped between the teeth. If you pack that food beyond the gum level, unfortunately, nothing that you can use, it will reach that deep. And that's why you need to call us in order for us to use the right tools to clean that area. So if you lose a filling, you open the contact. So if the contact is really tight between the two teeth and you break a filling and you're not aware of it because the tongue does not feel the change in the shape of that tooth, then you're gonna start noticing it when the contacts open and then you have the food trapped in between. That's number one. Number two, I see it a lot in patients that clench and grind. Clenching and grinding is that natural force that is consistently being applied on the teeth. And what that does, stimulate the teeth to move around. When the teeth move around, if they're tight, they move around and they twist, it just opens up the contact. And I see rotation, even with the patients that never had fillings, I see the rotation of the teeth because of the clenching and grinding. Number three, if you had tooth movement to realign the teeth, whether with Invisalign or braces, and you don't wear your retainers, things are going to shift and move around. Remember, teeth like to move and respond to touching each other. So if you have a very heavy, hard bite, then you're going to stimulate the teeth to move a lot faster than other patients. So wearing your retainers or wearing a night guard, that's another appliance that you can wear in order to stop the shifting and the rotating. It will be very helpful for these teeth to eliminate or to prevent the food trap. That's the third thing. The last thing what happen is if you're starting losing bone around the teeth. Remember, bone keeps the teeth in place. It's the anchor around the roots. The root is an anchor, and then you have the foundation, which is a nice, tight, healthy bone around it. So it doesn't matter how much pressure you're putting on the teeth. If you have a healthy bone, that will delay the shifting of the teeth. But if you're losing bone, or the bone integrity or bone density is changing over time and getting softer or thinner, you find their shifting is a lot faster and a lot sooner, and that can create a food trap. What do you do with a food trap? Please give us a call, have a professional, use the right tools and use the right instrument to keep that area nice and clean without injuring or traumatizing the area, so you don't end up with a more severe conditions that I have to fix. All right, that's it for now. We love you, be safe, and DS out.